Alex, well, what
Hello.
did you see today in the HFA meeting?
So it's day one of our HFA World Congress in Vienna. We've got the Acute Heart Failure Congress. We've already had some great sessions on cardio-oncology. I've learned that cancer can be driven by heart failure. So we should be more aware in following up our patients now they're living longer to check for cancer.
Plus, we need teach oncologists to send us the patient when something is wrong.
Yeah, well, I think we're going to that mission of trying to prevent heart failure caused by their drugs, but we also have our heart failure patients getting cancer now. So it's this sort of collaboration between both oncology and cardiology in the modern world of practicing medicine. So that was really interesting. There was a great acute shock session where we learned a lot about myocarditis, Takotsubo syndrome, which I'm interested in, and also sepsis and the challenge of how to manage patients with cardiogenic shock on the intensive care unit or after big stresses where we can't use catecholamines, and maybe there's data that the catecholamines are making it worse.
And what I learned in the late-breaking trial sessions, I also learned 2 or 3 incredible things. One very small study, though published in Circulation today, done by the Duke team, and the hypothesis is that maybe during acute heart failure there is a shift from the venous blood from the gut toward the right ventricle, and this may increase congestion. And in fact what they did together with an anesthetist, they reduced the sympathetic nerves tone in the guts, and very likely the blood came back to the guts and the patient had a lower wedge pressure. Now it's few patients, it's published in Circulation as a short report, but I think more is coming, and
well,
this
interesting.
is just great.
Yeah,
it's really a great hypothesis at least. And I also saw a large global trial named Report HF, many thousands of patients from all around the globe. And interestingly enough, we see over the years with this global trial that was done very recently, that we see more and more patients, the patients being more and more similar around the globe. Now there's still some area where there is much more de novo patients, still some area where treatment optimization is still far from perfect. But again, I think we are slowly having some positive impact of guidelines, and this kind of meeting help for sure people to have the same way of thinking and treating their patients. Did you see other things during this first day?
Well, I was going to say, we've got so many people from all around the world. It's good to know that actually they're going to come to Vienna and learn things that are going to be relevant to their heart failure patients back in their hospitals in their countries. So entertainment, the debate session, absolutely great. Eugene Braunwald overseeing it, giving us some pearls of wisdom from his insights from his career. And then we had a great debate on the role of revascularization in ischemic cardiomyopathy. Still controversy. The conclusion is we need another study, we need more data. Even the long-term stitch data has its flaws. We can't conclude that revascularization is right for everybody. I think for selected patients, yes, based on the data we know, but not just as a routine strategy for all our patients with ischemic cardiomyopathy. And then at the end, we had a very hot topic, this atrial fibrillation, catheter ablation for heart failure patients based on Castle AF. We had the PI from Castle AF, and then we had Milton Packer giving the HFA perspective. He had some challenges. The slides failed. He had to keep the audience entertained for 5 minutes, and it was very funny. And he just came with the rules that we apply in heart failure to our trials. Whether it's a drug, a device, it doesn't matter. We have the quality scientific rigor that's required. And unfortunately, Castle AF, although it was published in the New England Journal, it really didn't meet that bar that we would accept for changing practice. So again, the conclusion, we need more studies to really understand who will benefit from AF ablation. I don't think it's for everybody, and we need to be going for larger trials, again with hard endpoints, clinical outcomes.
It's great, Alex, and it shows that really, as you said, it's a global meeting and we have many, many things to learn.
Yes, and this is just day one, so we've got so much more ahead, and we look forward to this in this wonderful city of Vienna.
Absolutely.